Good afternoon and welcome to Counting the Homeless in Your Community, DCA Fall Conference 2020. My name is Dave Wisnett and I will serve as your moderator today. In my capacity at DCA, I am the Division Director for the Housing Assistance Division, which includes the work done by today's great panelists, Mike Thomas and Ambra Hauser. Before we get started, there are a few housekeeping items to please keep in mind as we go through today's presentation. If everyone could please keep your mic muted during the presentation, that would be great. If you have any questions during the session, feel free to type those into the chat. We're going to save all of the questions until the end, and I'll read those out during the Q&A portion of the presentation. The session is going to be recorded, and the presentation and materials will be available after the conference to everybody. So don't worry if you miss anything or you have to get up for a minute, you will get a copy of everything. And if we don't get to all of the questions during the session, no worries there either. We're going to answer all of those in writing that we don't have an opportunity to get to today, and we will return those to everyone. You're also going to get an evaluation immediately following the presentation. That's going to be emailed to you. If you could complete that, we really would appreciate that, and we value your feedback. So I'm going to go ahead and move now to introducing today's panelist. Mike Thomas is the Continuum of Care Program Manager in the Office of Homeless and Special Needs Housing at the Department of Community Affairs. He manages activities associated with the Georgia Balance of State Continuum of Care, which covers 152 counties. Mike has been with DCA since March of 2015, where he also worked as a coordinator for the AmeriCorps State and Emergency Solutions Grants programs. Prior to joining DCA, he was the Director of Grants Management at Action Ministries, an agency that provides hunger relief, housing, and educational programs throughout the state. In that role, Michael also managed a large grant portfolio that included various federal and state homeless services programs, and he also worked as an assistant financial examiner for the Georgia Department of Banking and Finance. Ambra Hauser is our other speaker today, and she currently serves as the data analyst in the Office of Homeless and Special Needs Housing at DCA. Ambra has the responsibility of preparing data for and submitting all required HUD reports for the COC, and that is a lot of reports. So we really appreciate her great work. Most recently, Ambra has been tasked with developing and executing a racial equity improvement framework to assess the scope of racial disparity and implement data-driven strategies towards improvement. She joined DCA 2 years ago and brought her public health education and statistical experience, as well as her professional and volunteer years of serving vulnerable and underserved communities across the nation. She is also a proud AmeriCorps Vista alumna. So with that, I would like to officially kick this session off and hand things over to Ambra.
Now remember, the president is out of the hospital. He is back in a White House that has become, in the words of one source.
So thank you for that. Thank you all for joining us and deciding to be in this session. Counting the homeless in your community and mobilizing your community for January 2021 point in time count. Throughout this presentation, we will have polling questions. We hope that you all will engage with us through participation of this polling questions.
I would note, Ambra, we do have someone that seems to have the news on in the background. If you could please mute your microphone.
Thank you for that. So the agenda today is broken up in 3 parts. I will review the background and foundational information related to the point in time for part 1, which is what is the point in time count. I will then give the floor to Michael Thomas to present on how the Balanced Estate COC specifically executes the point in time for part 2 entitled, How Does the Balanced Estates Continuum of Care Collect Data? And lastly, I will then engage in how those on this call could potentially be involved in mobilizing your community for the upcoming January 2021 count for part 3 entitled, How Can I Be Involved? So part 1, what is the point in time count? So during this part of the presentation, I will review some HUD definitions and then go over a broad overview of what the point in time count is. So again, let's start off with acknowledging a few HUD definitions so we may all be on one accord, as these terms will be used frequently throughout the presentation. So the first term is Continuum of Care, COC, which is a regional or local planning body guided by HUD that coordinates housing and services funding for homeless families and individuals. COCs do not provide direct services to individuals or families, but are the planning body designed to promote community-wide commitment to the goal of ending homelessness. Literal homeless, defined by HUD, is an individual or family who lacks a fixed, regular, and adequate nighttime residence, meaning one has a primary nighttime residence that is a public or private place not meant for human habitation, is living in a publicly or privately operated shelter designated to provide temporary living arrangements, including congregate shelters, transitional housing, and hotels and motels paid for by charitable organizations or by federal, state, and local government programs, or is exiting an institution where he or she has resided for 90 days or less and who resided in an emergency shelter or place not meant for human habitation immediately before entering the institution. So I wanted to specifically read those two definitions out because these two definitions or terms are often confused, and I wanted to be sure that we were all on the same page as we continue throughout this presentation. The other terms are relevant to the demographic information collected through the point in time count. So I won't read them verbatim, but I will just point out for survivors of domestic violence, this is individuals who are currently experiencing homelessness because they are fleeing domestic violence. A veteran is known as someone who served on active duty. And this does not include inactive military reserves or the National Guard unless that person, again, was called up to active duty. So youth is defined as persons under age 25. So HUD collects and reports youth data based on persons under 18, which are identified as children, and then persons between ages 18 and 24, which are identified as youth. Parenting youth, youth who identified as a parent or legal guardian, and then unaccompanied youth is youth which is persons under the age of 25 not accompanied by a parent or guardian. So we have our first polling question related to the HUD definition of literal homeless. You should see the polling question pop up on your screen. And it reads, which of the following examples qualifies as literally homeless by HUD's definition? Please select all that apply. So I'll give a few minutes for you all to answer that question.
So about 60% of you guys have voted. So if you'd like to participate, please do so now. The poll will close shortly.
So it looks like a great percentage of you all answered correctly. The correct answer choices were C and D, which were the last two. The individual living in a vehicle, which is sheltered, not meant for human habitation, and the individual staying in an emergency shelter, which is a place designed to provide temporary living arrangement. Though couch surfing is not a consistent living arrangement, it is not considered literal homeless. The individual with income to pay for a hotel is also not considered literal homeless. These two scenarios are often confused with literal, but with HUD's definition of literal homeless, there are certainly programs willing to provide additional services and assistance towards permanent housing. However, they are not considered literal homeless by HUD's definition. So again, thank you for participating in that. The point in time count is a census or count of all sheltered and unsheltered persons experiencing homelessness on a single night in January, i.e., at a given point in time, including some required demographic information and characteristics about persons as defined in the annual data collection notice. HUD requires that continuum of care organizations nationally conduct an annual count of people experiencing homelessness who are sheltered in emergency shelter, transitional housing, and safe havens on a single night. Continuum of care also must conduct a count of unsheltered persons experiencing homelessness, also known as the street count, every other year, odd number years. Each count is planned, coordinated, and carried out locally. In other words, every year, annually, a snapshot of persons experiencing homelessness through the sheltering systems in place is conducted, and every other year, an odd numbered year, such as 2021, a snapshot of persons experiencing street homelessness is additionally conducted. And just to be clear, the point in time count, I know the definition says that it is a census or count of individuals, but this is something that is completely different and separate from the national census that is done every 10 years. COC, again, is a regional or local planning body guided by HUD that coordinates housing and services funding for homeless families and individuals. The state of Georgia has 9 COC organizations in which each COC is responsible for planning and executing their own PIC count under the same HUD guidance. The PIC count, again, is conducted during the last 10 days in January. So sometimes I get questions on why January, why the last 10 days? And HUD has stated that winter likely maximizes the response system resources due to the cold weather. And it's conducted at the end of the month to capture, to include individuals that were able to use benefits potentially at the beginning of the month, but benefits were not substantial for the entire month. With our current climate of living in a worldwide pandemic, HUD continues to prioritize the health and safety of people experiencing homelessness and those who serve them. HUD anticipates requiring COCs to conduct shelter PIC counts, but has not determined what will be required for the unsheltered PIC count this year. HUD will notify COCs via listserv as soon as they decide how to proceed. I wanted to make that note as we continue to talk about January 2021. So the PIC count planning consists of methodologies for the sheltered and unsheltered count, including enhanced approaches for hard to count geographies and subpopulations. A data quality plan to ensure that we are collecting accurate data, identification and confirmation of locations to count sheltered and unsheltered persons, survey development, in which the survey is used to collect the demographic and characteristic information, volunteer roles, recruitment and training, use of incentives if necessary, PIC count committee membership, roles and responsibilities, date and time for the count, the night of the count, and any related count approaches occurring in the following 7-day period, as well as count publicity. So the Balance of State Continuum of Care consists of 152 counties. Organizationally, the COC recruits county count coordinators and empower coordinators to completely plan and execute the PIT count locally. This is a role that is unique to the Balance of State. So as you can see, there's a lot of planning that goes into executing the PIT count. To further paint a visual, in order to collect information on the night of the count, many volunteers will canvass the street for persons experiencing unsheltered homelessness and will conduct a survey on those individuals confirmed as meeting HUD's definition of literal homeless. And that is how the data is collected. The data collected from the PIT is used to measure homelessness on a local and national level and are published annually on HUD Exchange website, which can be viewed by COCs and the general public. PIT count data are also provided annually to Congress as part of the Annual Homeless Assessment Report, also known as the AHAR. The AHAR is used by Congress, HUD, and other federal departments and the general public to understand the nature and extent of homelessness. HUD's PIT count data has become increasingly important as a measure of our local and national progress related to preventing and ending homelessness, as well as provide insight to develop strategies toward the goal of making homelessness rare, brief, and a one-time occurrence. So this is where I would turn the floor over to Michael Thomas for part 2 of this presentation entitled, How Does the Balance of State Continuum of Care Collect Data?
Thank you very much, Ambra. And thank you for the opportunity to present this information today. Some of the most complex topics associated with the point-in-time count are the methods used to collect data and derive final estimates of homelessness at the county level across the 152 counties covered by DCA for this effort. In this part of the presentation, I'll walk you through these processes. I will discuss how the overall methodology is adopted, tools used to survey those experiencing homelessness, and data contained in the final report that must be submitted to HUD. One of the most important things to point out here is that the overall purpose of this effort is to facilitate mandatory reporting to HUD, and so all elements must be compliant with HUD requirements. And I will note once more, this effort is completely separate from and unrelated to the US Census. Next slide, please. So here I'll talk about how the methodology is developed. As the collaborative applicant for the Balance of State Continuum of Care, which is a very specific role defined by HUD, DCA has been designated by the Continuum of Care governance to carry out administration of the point-in-time count. However, DCA does not provide final approval for the methodology. DCA staff develop an initial suggested methodology, which then must be approved by Continuum of Care governance. The first step for approval is review by the Standards, Ratings, and Project Selection Committee of the Balance of State Continuum of Care Board of Directors. This is the most detailed level of review and may or may not result in requested changes to the methodology. The second step is approval by the Board of Directors. Once the committee approves the methodology, it's moved forward to the board with a recommendation for approval. The board may approve the methodology as is, or may also opt to request changes. Once the methodology is approved, DCA has the official green light to proceed with the overall plans established in the methodology. This involves contracting with partners to provide necessary products and services, and that includes contracting with local partners to serve as count coordinators in their communities, in that role that Ambra mentioned just a couple of minutes ago. Count coordinators typically enter a contract which allows DCA to provide some limited financial support for the count effort. The final part of the process is training and implementation. During this phase, DCA provides training and tools for count coordinators to organize local activities. Technical assistance and support are available throughout the entire process. Next slide, please. So here I'll talk about the elements that are specifically defined in the methodology. The methodology for the point-in-time count defines 3 very important things. In odd-numbered years, it defines certain details associated with the unsheltered count. It also defines certain details associated with the sheltered count and the predictive methodology used by the continuum of care, which I'll talk a little more about. For the unsheltered count, the methodology establishes a single night during the last 10 days of January when the count will occur. As Amber mentioned, that is required by HUD that it be in the last 10 days of January. So the methodology chooses which specific night it will be. The unsheltered count lasts for one night and is followed by a 7-day service-based count. During that time, people presenting homeless at service providers are asked where they were on the night of the count. Certain identifying information is used to deduplicate to the extent possible and to the extent that people are willing to provide that information. The methodology also defines the target geographic area for physical counts and the survey tool that will be used to collect data from people experiencing homelessness. It's important to note that the methodology for the 2021 count contains a contingency clause allowing DCA to adjust its approach for the unsheltered count based on any updated guidance from HUD that may be necessary due to the COVID-19 pandemic. It's still unknown if HUD will have the same requirements as usual for in-person canvassing, or if its guidance will be modified from the usual expectations. DCA is proceeding as usual unless and until further guidance is provided by HUD. So the methodology further defines the process to be used in the sheltered count, which counts people staying in emergency shelters, transitional housing, and safe haven, although there is no safe haven in the balance of state continuum of care. And when we say emergency shelter and transitional housing, that means as they are defined by HUD. An agency level survey is administered to agency officials at these facilities to collect the data. And then to the extent possible, this data is reconciled with data in the Homeless Management Information System, which is a system in which data must be entered for people experiencing homelessness by any agencies utilizing federal funding through HUD. Finally, the methodology defines the process for development of a predictive model that estimates unsheltered homelessness in areas that are not physically counted. This model is developed in partnership with a research institution. The predictive model uses data from physical counts, along with variables known to correlate with homelessness, to estimate homelessness based on county-level demographics. Data from the predictive model are combined with data from physical counts to derive the final numbers reported to HUD. Next slide, please. So the predictive model for the 2019 point-in-time count was developed under contract with a company called Simtech Solutions. The Continuum of Care has contracted with Simtech for this service once again for the 2021 point-in-time count. The model is an updated version of one that was originally developed by Kennesaw State University. The model uses variables shown by research to correlate with homelessness and applies those variables to county-level populations with adjustments for demographic features. This method, while we will acknowledge that it is not perfect, has been recognized as a viable way to estimate homelessness when physical counts may or may not be feasible. Across 152 counties, it's not feasible to have every square inch of every county counted. So that's why we use the predictive model here. This strategy is also used in many other places throughout the country. One new option being explored for the 2021 count associated with this is inclusion of margins of error in the final report on the count. With regular use of predictive models and statistical sampling methods to derive homelessness estimates nationwide, some stakeholders have suggested that this inclusion would offer a more transparent presentation of what the numbers really mean. DCA is proactively considering the inclusion of this information, if possible, in our final written report. Next slide, please. It's important to understand that homelessness estimates provided by the predictive model only give us a raw numerical estimate of unsheltered homelessness. The model does not break that number down demographically. However, demographic breakdown is required for HUD reporting. There will be more details on the required demographics for reporting in a moment. Since the model does not provide a demographic breakout, data from the physical count surveys that are extrapolated across the predictive estimates to achieve that breakdown. So we use what we collect in these surveys where physical counts are conducted, and then that gets extrapolated across all of the data from the predictive model. That is why accurate and complete physical counts in strategically targeted areas are crucial for the final report to be as accurate as possible. As statisticians like to say regarding mathematical models, garbage in equals garbage out. So we need to make sure that what we are putting into the model is as good as it possibly can be. Next slide, please. So while my overall purpose here is definitely not to stump for a specific product, I would like to point out some of the features offered by the Simtech Solutions tools that are being used by the Balance of State Continuum of Care. This will illustrate why we have chosen these tools and how they contribute to a higher quality count. Simtech provides a mobile app and online portal for collecting survey data from people experiencing homelessness. The app is available on iPhone and Android, and there's also an online portal that can be accessed from any computer connected to the internet. The app can collect data even when offline on cell phones, and then upload the data when connectivity is restored. So that assists when people are counting in rural areas. These have completely replaced the previously used paper surveys, which DCA was required to design, print, distribute, and then recollect across 152 counties. This switch has resulted in a much more efficient process, allowing staff to focus more on data quality. Simtech also provides an online command center. This is where DCA staff actively monitor surveys being completed and uploaded by canvassers on the night of the count. Having real-time access to the surveys allows staff to monitor for any apparent data collection issues, and then we actually have the option to contact volunteers directly to correct those issues. On the back end, the command center allows for thorough data quality review and revision of surveys if that should be necessary. It also produces a report designed to be friendly for HUD reporting purposes. The final added benefit that I will mention is technical support and training from Simtech Solutions, which is offered throughout the design and implementation process all the way through final reporting. Next slide, please. So on the previous slide, I discussed the strengths of using the Counting Us app and the mobile command center. Now we'll watch a short video from Simtech Solutions so you can see what these tools look like in action. So now we will put up this short video.
We're going to move into a breakout to watch this video. If it does not automatically play for you, please click the play button. After the breakout, we will automatically move back into the main session and the presentation will continue.
Right,
We're now back in the main session.
Thank you. So on this slide, you see a screenshot of HDX. What I'm about to say is a repeat of information, but it is very important information, so it does bear repeating. The ultimate purpose of the point-in-time count is to facilitate reporting to the U.S. Department of Housing and Urban Development. This required reporting allows HUD to inform Congress on the overall national trends in homelessness, which is an important consideration in determining funding amounts and allocations for federal homeless services programs. Reporting for the point-in-time count is done through an online system called the Homelessness Data Exchange, or HDX. For the 2021 count, a recent communication from HUD actually suggested that they will move reporting to a new system called HDX 2.0. We do have some experience reporting in this new system for other purposes, but this will be the first time we've reported point-in-time count data there. We don't have additional details at this point, but we'll be awaiting further guidance from HUD on any new processes. The point here being that HUD has an online portal through which this data is submitted. Next slide, please. So now I'll talk about some of the categories in the reporting. When data is reported in HDX, it is broken down by household type and demographics. Aggregate point-in-time count data is broken into households with at least one adult and one child, also commonly known as family households. Households with only children, this is very limited in the balance of state continuum of care, and households without children. In the balance of state continuum of care, that is mostly individuals experiencing homelessness, but it could also be a household with only adults. Within each household type, data is further broken into age, gender, ethnicity, race, and chronic homeless status as defined by HUD. Next slide, please. Special subpopulations are also reported to HUD. The first of these is veterans. Veterans are delineated into households with at least one adult and one child, and households without children. Within each household type, the same demographic delineation as shown previously for the general homeless population is reported. The second subpopulation is youth. This is delineated into unaccompanied youth households and parenting youth households. The same demographic delineation as the general homeless population is also reported here under each household type. Next slide, please. Finally, there are additional populations of interest to HUD that are reported from the aggregate homelessness numbers. This includes adults with a serious mental illness, adults with a substance abuse disorder, adults with HIV/AIDS, and survivors of domestic violence, which in this context means survivors actively fleeing who are experiencing homelessness due to domestic violence. So now we will put up a quick poll for the audience. So you should be seeing the poll now. Do you believe there is a particular subpopulation experiencing homelessness in your local area more than other subpopulations? And the choices are family households, veterans, youth, which is people up to age 24, or domestic violence survivors. So we'll give you a couple of minutes to complete the poll.
About half have participated. We'll be closing the poll in a few seconds, so please participate if you would like to do so.
Okay, so now you should be seeing the results on your screen. It looks like the largest percentage there was veterans, followed by family households, then domestic violence survivors, and youth. So just for context, in the most recent count with an unsheltered count, so that's 2019, 29% of the total homeless population was family households. And also of note, of the family households that were homeless, 92% of those were sheltered. So that means the vast majority of family households were actually in an emergency shelter or transitional housing. 9% of the total homeless population was youth, but that might be an underrepresentation because we know this population is difficult to count. 6% was veteran households, and that is consistent with the amount of resources. There are a number of homeless resources out there for veterans that are not available for the overall homeless population. Some of you may be aware of the Supportive Services for Veteran Families program, which was launched years ago. That is one significant example. And then finally, 10% of the total population was survivors of domestic violence. Again, that is based on the 2019 count. So now I will turn the presentation back over to Ambra Hauser.
Thank you. So I'll review the last part of the agenda, which is how can I be involved in the upcoming January 2021 point in time count. So I'll review in this session, I will review the Georgia COC organizations as well as some practical ways of involvement. So as mentioned throughout this presentation, Georgia is comprised of 9 COC organizations. For those that would like more information on the PIT in your area or would like to be involved, please contact your local COC. I wanted to put this up so that we can have time here to identify our local COC as well as jot down our local COC information. Again, the Balance of State COC is comprised of 152 counties, which is widely the northern and southern rural counties. Atlanta COC, for example, is comprised of the metro area only, and the Fulton County COC is comprised of the Fulton County area outside of the Atlanta metro area. So those are some things to just remember as you identify your local COC. And then also this presentation will be sent out to all of those who participate on this presentation today. So if you're asking yourself, how can I be involved and what is my capacity to serve within my role? We identified 3 practical ways to mobilize your community in the upcoming PIT count just 3 months away. So first, one way could be by publicizing the upcoming count through broad mass media messaging. This could be an opportunity through your community connections to share what will take place in your community. This will take collaboration with your local COC on the messaging and or the local count coordinators. Another way is mobilizing through recruitment. As a local government, through connections, you may have the ability to reach many local community members and recruit individuals to serve as volunteers on the night of the count. For example, you may recruit high schoolers, local small businesses, nonprofits, neighborhood association members, local organizations that may not be aware of the count yet, but are willing to serve. This will take collaboration with your local COC and or local count coordinator. And then lastly, as Mike outlined, as one of the elements within the Balance of State methodology, service-based counts last 7 days after the night of the count. So coordinating participation in service-based counting could be another way to mobilize your community and participating in the upcoming PIT count. Again, this will take collaboration with your local COC and or local count coordinator. As mentioned earlier, the Balance of State COC recruits count coordinators to locally plan and execute the count. DCA empowers these count coordinators with training and guidance to successfully execute the count as an independent local body. Also understanding that the canvassing of the county coverage contributes to the predictive model. Currently, the Balance of State is in the early phases of identifying targeted counties and recruitment of county coordinators. So these are just 3 ways we identify potential involvement: publicizing the upcoming count, recruitment, and coordination participation. So based on your capacity to serve, please contact your local COC for additional opportunities to serve for the upcoming point in time count, which it will be January 2021. So for our third and final polling question, it reads, what type of participation based on your role would you likely commit to mobilizing your community? Select all that apply.
We'll be closing the poll in a few seconds. If you'd like to participate, please do so now.
Thank you all for participating in that poll. Again, please follow up with your local COC, and as well as this presentation will also be sent out to all who are on the call today. So thank you for your time and participation. At this time, we are opening the chat box for questions. If you are interested in participating and would like to be in the loop for the upcoming trainings and orientation for the Balanced Estate specifically, please contact pitcount@dca.ga.gov. Or if you have any PIT related questions for myself or Michael, you can also contact us here. And I will turn it over to Dave.
Thanks, Amber, and thank you, Mike. Really appreciate the presentation. We've got a few questions that have come into me directly while y'all have been talking, so I'll just go ahead and throw these out there, and whoever would like to answer those can do so between the two of you. The first question is, do the homeless really want to talk to the volunteers? What about security? Has anything bad ever happened?
So I can take that one. That is something that HUD certainly discusses, and there is a lot of guidance on the HUD website for how to organize the homeless count. We have not had serious incidents in the balance of state COC. In terms of people wanting to speak with canvassers, one of the things that some count coordinators choose to do if they utilize the limited funding that DCA makes available is to provide some sort of incentive. So sometimes that's a bag of food or a bag with some toiletries, things like that. So there are options like that available. But overall, people are more willing to speak with our canvassers than you might think. And a lot of times that's because the canvassers are volunteers for local organizations that are already known amongst the homeless population. It might be organizations that already have a street outreach team, things like that. So we really haven't experienced significant issues around those things in the balance of state. I will say we do encourage people to the extent that it's feasible, to at the very least, let local law enforcement know what they're doing on the night of the count so they're aware that it's happening, so that if an issue should arise and they get a call, they know what's going on. But we have not had significant issues.
Thanks, Mike. The next question is, are there any parts of the state where you need more help in the PIT?
So it's hard to say at this point because we target specific geographic areas based on that predictive model we were talking about. There are certain places that we need to have sampled to make that model work well. And we're still in the initial stages of figuring that out with our research partner for the 2021 count. So it's hard to say if there are specific areas, but what I can say is the more rural the area is, the greater the chance that we need help there. So if you are thinking of an area, if you're located in an area where maybe there is not a strong homeless services provider, there's not a street outreach team, it's one of the more rural counties, we probably need assistance there.
Thanks, Mike. The next question is, how do people know where to find the homeless? I know where a few are in my town, but I'm sure there are more.
So generally, it depends on the area. If it's an area where you have a homeless services provider, they usually have that knowledge and they are usually the one leading the count. If you're in an area without that, it really is a matter of following up with any institutions that you have locally. So a lot of times local law enforcement might know where people who are experiencing homelessness are living. If there is a mental health provider in the area, they might know. So it's really just, and that's part of our planning guide that we provide to local count coordinators. It's a matter of sort of mapping out what resources are in your area and then figuring out which ones to best follow up with to identify where people are staying.
Thank you, Mike. Next question is, I volunteer with a local veterans group. Can I volunteer or we volunteer just to count veterans in the count?
So this count has to cover the entire homeless population. That is the mandate from HUD. The issue is if we count specific subpopulations in one area, we can end up over sampling that subpopulation. And then when we extrapolate that data across the data from the predictive model, we overrepresent that population in the overall homeless numbers. And while it might seem like that would get us more funding for veterans, we as a continuum of care actually lose point on our applications if we show drastic increases. So what we really need to do for this count is sample the entire homeless population to the extent possible. And we know there are veterans in that population and we want them to be counted, but we don't really have the ability to focus on individual subpopulations.
Okay, and that kind of ties into the next question, Mike, is, what would happen if an accurate count is not done? Would that be less money? What would the impact be? So I guess in other words, why is it important to have an accurate count?
I mean, I guess my answer to that is the reason it's important to have an accurate count is we want to represent as realistic a picture as possible. So, if that means showing an increase in homelessness, then that's what we want to show if that is what is real. If that means showing a decrease, that's what we want to show if that is real. So I don't know if, I might need more details on what you mean, because we always try to get as accurate a count as possible. And so I don't know if I can provide information without a little more detail. That might be one I need to follow up on.
Okay. And then, if the person that asked the question wants to send me a private message, that would be great. And we can certainly get more into that if we need to. Next question is, counting an entire county seems like a daunting task. How many people usually are involved in canvassing a county?
So again, it really depends on the county, and it depends on the local knowledge of the count coordinator. What we usually encourage count coordinators to do is to segment their county off. So almost, have a visual picture, a map of your county. And once you've followed up with local providers, law enforcement, whoever it may be, to figure out where you think people experiencing homelessness are, you would prioritize those areas for counting first, and then you would move on to the more rural areas or the areas where you think people are less likely to be found. So that's sort of the approach that we recommend. It is a daunting task to cover an entire county, but in terms of number of volunteers and how to prioritize areas, it really depends on the local area. I don't know if there's any one number I could give you that would be correct without knowing more about the local context.
Okay. And this next question is one I think y'all kind of covered a little bit in that first polling question, but someone is wondering about if you all count people in extended stay motels, and if no, why not?
The only instance in which a person in an extended stay hotel might be counted would be if their stay is funded by a government program or a charitable organization. Otherwise, we do not, and the reason for that is that they do not meet the HUD definition of homelessness for which this count is designed to report on.
Okay. And we've got one question from Jennifer. We may touch base with you on that offline, because it's not really related to the PIT, but we would love to discuss a situation with you. The last question I had, Mike, unless we have any more, is do you think COVID will increase or decrease the counted numbers, or what impact is that going to have on the point in time count?
So anything I say at this point is clearly going to be speculative. It is very hard to balance all the variables to figure out what the impact could be. There could certainly be more people experiencing homelessness due to COVID in January, particularly if the eviction moratorium expires. However, we also have an unprecedented amount of money out there via the CARES Act. So there are more resources. So, I think it's, in my opinion, and I'd like to emphasize this is my opinion. It is not based on anything other than anecdote. I think that we probably will see more housing instability, and we probably will see more people in positions where they might experience homelessness. But I also think that if they can be connected with resources, the ability to help them is there. So I don't know what impact that'll have on the final count, but that's kind of what I see playing out in my mind.
Okay, thank you, Mike. And I believe that is the last of the questions that we have from folks. Dana, do you have any remarks?
No, sir.
Okay, well, unless there are any other questions, I would like to thank everybody for coming today and everyone for participating in the fall conference. I know it's been a little bit different this year doing this virtually, but we really appreciate the great participation that we've had and the great feedback that we've had thus far from other sessions. We will send a survey out after this session, and if you have a minute, we'd really appreciate your feedback and what you learned. And I just hope everybody has a great rest of the week and a safe week. And again, appreciate you joining us today. And hopefully everyone will have the opportunity to join some more sessions in the fall conference before we conclude this year. Thanks, everybody.